Good day! For today's presentation, we will discuss two medical devices, specifically thermometer and pulse oximeter. Also, we will discuss a new device used in medicine as we move forward in this presentation. For an overview in this discussion, thermometer is a device used for measuring temperature. Pulse oximeter is an electronic device that clips onto a patient's finger to measure heart rate and oxygen saturation in his or her red blood cells. Lastly, the new device that we will discuss is iontophoretic drug delivery pouch and controller. Here are the presenters for today. For the first medical device, we have thermometer. What is a thermometer? A thermometer is a device used for measuring temperature of solid, liquid, or gaseous matter. Clinically, thermometers are used to measure the temperature of the human body. Nowadays, most thermometers use heat sensors to determine body temperature because of its ease of usage, accuracy, and quick results. The usual units of measurement of thermometers are Celsius and Fahrenheit. A clinical thermometer's usual temperature ranges from 35 to 42 degrees Celsius, and a healthy human body temperature is around 37 degrees Celsius. There are many different types of thermometers that can be used to measure temperature, and there are several ways to take a temperature using these thermometers, such as rectal thermometer is placed in the child's bottom, oral thermometer is placed in the mouth under the tongue, tympanic thermometer is placed in the ear, temporal artery thermometer scans the surface of the forehead, an auxiliary thermometer is placed in the armpit. A digital thermometer is made up of several components, including the probe cup, probe tip, probe, power button, hold button, unit change button, and screen display. First is the probe. The probe of the thermometer is usually long and thin, with a pointed tip that allows it to penetrate into the center of certain surfaces. There are two types of probe, the probe cup and the probe tip. The probe cup protects the probe when the instrument is not in use. However, not all digital thermometers are provided with one, while the probe tip measures the temperature of the body. The power button is used to switch on and off the thermometer. The hold button allows the user to keep the reading on display or on the screen. How this works depends on the model. And lastly, the unit change button changes the reading between degrees Celsius and degrees Fahrenheit. For the application of thermometer, a precise reading of a person's temperature is a crucial tool in the treatment of sickness. Thereby, checking body temperature with a thermometer is an easy way to see if a fever is present. Clinical thermometers are generally used to determine the patient's body temperature and assess if they are having a fever. A temperature of 38 degrees Celsius or greater on an oral, rectal, ear, or digital thermometer is termed a fever. The temperature measurement on an axillary or armpit thermometer will be roughly 1 degrees Fahrenheit or 1 degrees Celsius lower. Therefore, anything over 37 degrees Celsius is considered a fever. Fever is usually a symptom of infection or disease. These infections can be fast-moving or difficult to treat. Therefore, when a person experiences this symptom, a thermometer comes in handy in order to assess the situation and be able to prevent further complications, particularly in young children and individuals with a weakened immune system.
These are the steps in using a digital thermometer. The first step is to make sure to turn on the digital thermometer. Next is to place the tip of the digital thermometer to the oxter or the armpit of the patient. Third step is just wait for the digital thermometer to beep. Fourth step, after it beeps, remove the thermometer immediately. And lastly, interpret the result. There are do's and don'ts when using a thermometer. Starting with the do's. Wash your hands before and after use. Disinfect the thermometer after use with alcohol or with soap and water. Keep a record of the patient's temperature until it drops to the normal body temperature. Make sure your patient's armpit is dry to get the most accurate reading. Make sure to put on the protective cover after use. And make sure to store it in a place where children cannot reach. Next is for the don'ts. Do not play with the tip of the thermometer. Do not disassemble. Do not submerge in water. And do not put it away without washing it first. A dirty thermometer might infect the patient again. There are possible faults when using a thermometer. The possible error that could happen when using a thermometer is if there is no display on screen when pressing the power button. Additionally, the display screen would give vague readings. The reason for this error could be because the battery is installed improperly or the device has run out of power. Another cause of this error is weak batteries that give inconsistent readings. Thereby, it is imperative to always check the batteries in order to evade these incidents, and the thermometer could be used for a long time. The probable solution for this error is to always make sure to install the battery correctly, or replace it with a new one, or remove the batteries from the battery slot after use, and properly store them if the thermometer would not be used for a long period of time. Moreover, always read and follow the instructions that come with the thermometer.
Pulse oximeter. Pulse oximeter, also known as a pulse, is an electronic device and non-invasive test that measures the oxygen saturation levels of your blood. It is a small, clip-like device called a probe that attaches to a body part, most commonly to a finger or earlobe. Even minor changes in oxygen levels can be detected quickly by this equipment. These levels indicate how well blood carries oxygen to the parts of the body farthest from the heart, such as the arms and legs. Pulse oximeter observes a rapid measurement of oxygen saturation level in the body without using needles or taking a blood sample. They are frequently used by medical professionals in critical care situations such as emergency departments and hospitals. In the office, some clinicians, such as pulmonologists, may use them. Lastly, it is self-monitoring, painless when using, inexpensive, and easy to use, which explains its common use in the vicinity of home care. Pulse oximeter consists of two hardwares, a monitor and a probe. The monitor contains the microprocessor, battery, and display. This part of the device shows the oxygen saturation and pulse rate. It updates its calculations on a regular basis during use to provide an instant reading of oxygen saturation and pulse rate. It should be noted that this is a sensitive part of the device. Thus, it should not be subjected to rough handling, extreme heat, and spilled liquids. The probe senses the pulse. This hardware consists of two parts, light-emitting diodes or LEDs and the light detector. From one side of the probe to the other, light beams are shown through the tissues. Some of the light released by the probe is absorbed by the blood and tissues. The amount of light received by blood is proportional to the oxygen saturation of blood. The light detector recognizes the light emitted by the blood as it pulses through the tissues, and the microprocessor calculates an oxygen saturation value. The purpose of pulse oximetry is to see if the blood is well oxygenated. Pulse oximetry is used by clinicians for a variety of purposes, including to see how effective a new lung treatment is, to determine if someone requires assistance with breathing, to test how effective a ventilator is, to monitor on oxygen levels during or after sedation-induced surgery, to see if someone requires supplemental oxygen therapy, to see how effective supplementary oxygen therapy is, and to determine if a person temporarily stops breathing while asleep or apnea. Medical professionals use pulse oximeter to monitor the health of people with conditions that affect blood oxygen levels, especially while they are in the hospital. These can include chronic obstructive pulmonary disease or COPD, asthma, pneumonia, lung cancer, anemia, heart attack or heart failure, and congenital heart disease.
Pulse oximeters are a crucial monitoring tool, and using it properly is the key to getting an accurate reading. Here are the step-by-step process on how to properly use a pulse oximeter. First, press the white button at the base of the pulse oximeter to switch it on. Second, gently slide your index or middle finger in the device correctly, pointing towards the LED light inside with the nail surface facing up. Third, keep the finger at the same place for a full 2 minutes for stable reading. Wait until the reading stops changing and displays one steady number. Fourth, record the reading that flashes on the oximeter after it has established after 5 seconds. Take note, an oxygen saturation level of 95% to 100% is considered normal. Fifth, take multiple readings to check accuracy, identify its recording. And lastly, the oximeter will turn off automatically after 10 seconds once the finger has been removed. For the counseling, there are a few things to remember when using the pulse oximeter, especially if the patient is monitoring oxygen levels at home. Here are the important do's and don'ts before, during, and after using the device, and important reminders that must always be taken into consideration if measuring from finger. Before using the pulse oximeter, the patient must first check if the pulse oximeter has batteries, remove any dirt on the sensor because this can produce an inaccurate reading, remove any nail polish or false nails, or try a different finger, and warm his hand if cold as this may not show any results. Rest his hand on his chest at heart level and hold it still. Rest and make his body relax for at least 5 to 10 minutes before using the pulse oximeter. Position the probe correctly and make sure that the alarms are on. During the use of the pulse oximeter, make sure the patient is sitting still while getting the results. Make sure that the finger lines up with the red LED light. Rest it on a flat surface. Do not press down or squeeze the oximeter as this may produce inaccurate results. And if having difficulties in obtaining a reading, try repositioning the oximeter and move it to another finger. After using the pulse oximeter, start recording from baseline and record 3 times a day at the same time to check accuracy. Take extra measures if there is a change in the patient's health. And go to a nearest clinic or hospital if the pulse oximeter gives an oxygen level of 92% or less. Here are the important reminders that a patient must always remember. Proper placement is important for an accurate reading. Keep away from bright lights and shield the probe from direct light. Using the right middle finger and right thumb gives more accurate results. Making movements, such as shivering, may make it difficult for the probe to pick up a signal. Do not rely on the pulse oximeter to validate the patient's health condition or oxygen level because further assessments are still needed. After the pulse oximeter has established a stable reading, a patient must know how to properly interpret a reading. There are two different readings shown. First is the oxygen saturation percent of blood, and lastly, the pulse rate. The oxygen saturation percent of blood is shown on the top portion on the screen display of the device. This indicates the SpO2 range of the patient, wherein 95% or higher usually depicts a normal level of oxygen, and values under 90% are considered low and indicate the need for supplemental oxygen. The pulse rate is also shown at the bottom portion on the screen display of the pulse oximeter. However, the normal pulse rate can vary by age, in which the normal pulse rate for healthy newborn varies from 100 to 180 beats per minute. For 2 to 10 years old, ranges from 60 to 140 beats per minute, and 50 to 100 beats per minute for 10 years old and above.
Iontophoretic drug delivery patch and controller is a form of transdermal drug delivery that utilizes electrical current to drive or push ionized drugs through the skin's outermost layer, which is typically the main barrier to drug transport. Electrode patches have a unique composition that allows ionic movement into human skin tissue. The patches are made up of a semi-permeable membrane that must be in close contact with the skin for optimal penetration. Before we discuss its functions and benefits, let us first define iontophoresis. Iontophoresis is an electromedical method of delivering chemicals through the skin to a specific anatomical site. This electrochemical treatment avoids the potential adverse effects of medicating a local problem systematically while allowing for a much more concentrated drug dosage to the pathological site. Here are the functions of iontophoretic drug delivery patch and controller. It manages painful symptoms associated with superficial tissue structures by delivering anti-inflammatory medications deeper into the body's tissues. Iontophoresis is used to reduce inflammation that might be seen in musculoskeletal conditions such as lateral epicondylitis, medial epicondylitis, plantar fasciitis, tendonitis, bursitis, rheumatoid arthritis, and several entesopathic conditions. It is also used to treat hyperhidrosis disorder, which is a condition that results in persistent and excessive sweating, and treatment for calcific supraspinatus tendonitis, which is a condition where deposits of calcium build up in a tendon or muscle. This can lead to pain and reduced movement. Steroids, NSAIDs, local anesthetics, and salicylates are among the medications that can be administered into the subcutaneous tissues. In physical therapy and rehabilitation medicine, corticosteroids such as dexamethasone are the most commonly utilized medications with iontophoresis. Since the corticosteroid molecule is a water-soluble salt with a negative charge, it must be stored in the negative electrode drug reservoir. Here are the benefits of iontophoretic drug delivery patch and controller. The controller can calculate the total amount of medication administered by measuring the resistance of the electric current induced by the medication on a regular basis. Multiple drugs can be delivered in the same patch for therapies requiring variable timing of delivery. It permits the application of a lower voltage with diminished redness or irritation of the skin due to local histamine release and lowers the possibility of causing a thermal burn to the skin. Rate of drug delivery scales with the electrical current, which can be readily controlled by a microprocessor. And also, it is painless and has a rapid therapeutic effect. Since the drug is ionized, it stays longer in the affected tissues, being absorbed even 100 times more than taking a drug by mouth. Therefore, results faster but with less amount of medication. And lastly, absence or reduced chance of side effects or adverse drug reaction is observed.
And that sums up our presentation about thermometer, pulse oximeter, and iontophoretic drug delivery patch and controller. I hope you learned something new. Thanks for watching.